High-dose oral minoxidil does have a higher risk, of course, compared to low-dose oral minoxidil, but it could potentially give a even greater hair growth benefit, especially if you're someone that seems to have a sort of bottleneck or a poor response to lower forms of minoxidil, whether that's topical minoxidil or really just low-dose minoxidil between 0.25 up to 5 milligram. But again, you have to monitor your sort of physiological responses to minoxidil, especially at higher doses, carefully, and you have to titrate up to a higher dose slowly. Hello everyone, and welcome back to yet another video. So today we're going to be looking at high-dose oral minoxidil in a particular study that was brought to my attention by a subscriber of mine. By the way, you guys should consider joining the Discord server for this channel in the description below. Hey guys, before we continue this video, I would like to mention that we now have liposomal minoxidil sulfate on my website, folligens.com, folligenz.com, and if the order queue is available and open, you can order it there. We're running it as a cosmetic. There are other sort of botanicals inside of this particular topical that are pretty helpful when it comes to conditioning the hair. So that's at folligens.com, folligenz.com. That's folligenz.com. Go check it out and maybe even try it out. See you there. Now, oral minoxidil has gone from a curiosity to a core option in hair loss care, but how far can we push the dose, and for whom, still needs a clear biologically grounded answer. A fresh data point comes from a study titled, quote, High-Dose Oral Minoxidil for the Treatment of Androgenetic Alopecia, unquote, by Moreno Arones et al., published to Actas Dermosifiliográficas in the volume 116, issue 7, for July to August 2025. Now, this study is a multi-center retrospective look at 57 men who had already spent the prior year on low-dose oral minoxidil, so that includes 5 milligram and anything below 5 milligram per day, and then escalated to more than 5 milligrams per day for around 9 to 12 months. And this took place across sites in Spain and Brazil. So the ranges of this particular dose were from 6 milligram all the way up to 10 milligram. So we had 6 milligram, 7 milligram, 7.5 milligram, and 10 milligram groups. 86.1% of the people in the study went to the 10 milligram group. Around 7% had 7.5 milligram, 5.2% had 7 milligram, and 1.7 had 6 milligram. Now, another thing to note was that now for 80.7% of people in this study, they dosed their medications once nightly. 19.3% of subjects took the drug twice daily. Now, the goal of this study was to observe the safety and potential efficacy of high-dose oral minoxidil. And another thing worth mentioning is that nearly everyone kept running other therapies. So if you were taking dutasteride 0.5 milligram daily, as we saw in 87.7% of people, they continue to use it. And finasteride 1 milligram daily, we saw that in 12.3% of people, they continued to use it. And almost all of the subjects had previously been on 5 milligram oral minoxidil. So what happened after the setup? Well, the authors graded the paired photos on a scale, so 0 being no change, and 1 being less than 10% change, and 2 being between 10 to 30% change, 3 30 to 50%, and 4 being greater than 50% change in hair density gain. The mean score was 2.15. So about a 10 to 30% improvement on average. And here, distribution matters. 4 men, or 7%, saw no improvement. 10 men, or 17.5% of men, improved but less than 10%, so they gained less than 10% of hair density. And 26 men, or 45.6%, landed in the number 2 area of the scale. So in this particular band, these men saw anywhere between 10% up to 30% increases in hair density. And finally, 7 men, or 12.2%, hit the golden 30 to 50% gains in hair density. And then we have the other 10 men, the 17.5% of men, that cleared excess of 50% gains of hair density. That is amazing. So the translation here is that high-dose oral minoxidil helps some, nudges many, and leaves a minority unchanged, with a meaningful tail of big responders. So when you kind of average this out, you get that sort of 2.15 mean score. So typically people in a general population, according to this study, right? Maybe if we had more people in the study, it would be more generalizable. But if we were to just look at the study and what it's reporting, you may be able to expect a sort of 2.15 score on their particular scale, which will correlate to around 10 to 30% increases in hair density. Now, adverse events rose with the dose, but were mostly manageable according to this study. So again, adverse effects. 43 or 75.4% of men in this study did not have any adverse effects. Now, of the people that did have adverse effects, this included 14 men. So 24.6% of men in this study, 14 men in this study, had adverse effects. Now, when we are to break down what these adverse effects are between those 14 men, 10 of those men, 17.5% of men in this study, had hypertrichosis, so excessive body hair growth, and, that is completely manageable. You just, shave it off, right? 2 men, or 3.5% of men in this study, had tachycardia. Now, tachycardia is a condition where the heart beats abnormally fast, typically at a rate exceeding 100 beats per minute at rest. And this can be either temporary or it can be a chronic condition. And if it's chronic, that's not really good for your heart. If this is happening chronically due to your exposure to oral minoxidil, you should probably stop and not use that drug and just switch to a more topical option. Because if you're having tachycardia chronically at rest, you could potentially encourage left ventricular hypertrophy, or LVH, and this is a condition where the main pumping chamber of the heart thickens, and that's not good because it makes the heart work less efficiently, and it is a significant risk factor for developing other cardiovascular ailments. So if this is something that isn't going away after a month of use, quit the drug and just go to a different option. And in 1.7% of men, or in one man in this study, they had a headache, and another person, one man in this study, 1.7% again, had insomnia. And that insomnia might be tied to tachycardia. Maybe the racing heart is keeping people up, or maybe it's a headache. Who knows? But that is probably a sort of valid assessment that can be gleaned from this data. I would also like to say, once you're in the high-dose oral minoxidil ranges, hypotension or low blood pressure is another adverse effect that may happen, and it becomes very, very likely, again, in those sort of high doses, so you have to be careful. That's probably why many of these men are taking this medication at night, because, well, if you're sleeping, you don't really notice your blood pressure being low. But if you're taking it in the morning, like 10 milligrams straight up when you wake up, that could cause you to have hypotension episodes. You might, feel a bit lightheaded, a bit dizzy. Your vision may start to kind of, black out a bit. That's not good, especially if you're operating motor vehicles. So that's something to be mindful of and to be very careful of. The authors actually mention this in the body of the paper outside of the chart itself. So the authors say, quote, in 2 of the 57 patients, 3.5%, episodes of reflex tachycardia to hypotension were reported. This low prevalence is reassuring and is aligned with what has been previously published at doses of 7.5 milligram daily, not associated with clinical tachycardia. In our opinion, to maximize the safety profile of oral minoxidil, the best thing to do is to perform sequential increase in dose similar to its use for hypertension described in its technical datasheet. In the absence of adverse effects, we usually increase the dose from 2.5 milligram to 5 milligram after 6 months of treatment, and subsequently from 5 milligram to 10 milligram after a year." Unquote. Then the authors go on to talk about how they have an impression that even at low doses, there's some sort of compensatory biological mechanism that helps kind of reduce adverse effects. If the dose is increased progressively, this can be used to kind of avoid side effects to oral minoxidil. Now, in my opinion, and again, I'm not a doctor, but in my opinion, if you're already, dealing with high blood pressure and you're on another form of blood pressure medication, you shouldn't be dealing with oral minoxidil, let alone high dose oral minoxidil. You don't want to have a dangerous drop in your blood pressure because that could actually, kill you, not to scare you, but it can actually harm you. There's also PDE5 inhibitors like Viagra with its active ingredient sildenafil. I would say to be very careful when using these drugs alongside with oral minoxidil. And primarily it's due to the fact that PDE5 inhibitors work by relaxing the muscles of blood vessels in specific parts of the body, including your your wee-wee, right? Your penis, right? So that is having a vasodilatory effect, but it can also lower your blood pressure too, so you have to be careful not to combine sildenafil and oral minoxidil because, you don't want to crash your blood pressure. That is another sort of concern that I have, that I see a lot of telehealth companies these days kind of, for whatever reason, advertising. They're taking oral minoxidil and Viagra and they're putting it together and they're even combining other PDE5 inhibitors with it. And they're like, here, take it, use this, right? If you have blood pressure issues, don't. And even if you don't, still don't, because you might make a blood pressure issue, right? So if you're going to be on high-dose oral minoxidil or even low-dose oral minoxidil, get a blood pressure machine. I'll put a link in the description to one that I've used myself. I'm not on oral minoxidil, by the way, but it's one that I've used myself because I like monitoring my biometrics. I do think there is a way where you can sort of limit side effects, and this would be to split the base dose. So if you're taking 10 milligram per day, for example, maybe 5 milligram in the morning and 5 milligram at night, or you can kind of, split the dose into other mini doses throughout the day, and that probably should sort of reduce your side effect. Just my opinion. Obviously, go talk to a doctor. Now, there are some case reports when it comes to the use of minoxidil specifically, and especially at lower doses, and it seems to be with people who have a sort of genetic predisposition, and this is the incidence of pericardial effusion. Now, pericardial effusion is when you have a fluid buildup around the heart, and this can potentially be life-threatening. Now, I'll have my editor put some, case report pictures on the screen, but I've talked about this on my longer video when it comes to the use of oral minoxidil. So what I would typically say to people who consider oral minoxidil is definitely get your heart checked within the first 3 months of use. I would say get checked in month 1, month 2, and month 3. And every time you increase your dose, get checked in month 1, month 2, month 3. So you you kind of reset the frequency in which you're getting your heart checked, if that makes sense, right? And I would probably do this in the first year every 3 months after you've checked yourself for both the first 3 months of that year. So from that point on, in year 1, get checked every 3 months, and then after that, get checked every 6 months. That's if you really want to be particularly, on your shit when it comes to potentially catching any sort of early signs of pericardial effusion, because if you do have that, you don't want it to creep up on you and you don't want to cause any sort of issues in the future, right? Especially if you're going to be on this drug long term. Another point to kind of note is that there will be genetic bottlenecks when it comes to the response of oral minoxidil. Because imagine this, right? Even in this high dose oral minoxidil study, there were people who didn't even respond as well, right? There were people who had substandard responses. Like, I would be pretty pissed off if I'm on 10 milligram oral minoxidil, having my fucking heart jump out of my chest, and I'm still not getting any hair growth benefits after 6 months. That would really suck. But the reason why that might be the case is due to a sort of genetic bottleneck, mainly when it comes to the sulforotransferase enzymatic activity in the outer root sheath of the keratinocytes in your hair follicles. Now, in my Tressless community post on the Tressless community website, I push this further because activation isn't the end of the journey here. Even after minoxidil becomes minoxidil sulfate inside of the keratinocytes, it has to reach the business end of the follicle, and this is the dermal papilla. The dermal papilla is the mesenchymal control hub that orchestrates anagen or growth, signaling to the matrix and the stem cell niches to build thick terminal hair. Now, again, this can only effectively happen if you have enough of the sulforotransferase enzyme in your outer root sheath. So let's assume you do have enough of that enzyme, right? So now you have successfully transformed minoxidil into its active growth ingredient, minoxidil sulfate. Well, if you have a sufficient amount of minoxidil sulfate, you need to transport that minoxidil sulfate into the dermal papilla area. But to move minoxidil sulfate after it's been sort of converted, it requires a two-step transport relay. First, you need to actually get the minoxidil sulfate out of the keratinocytes and into extracellular space, and that's the space in between different cells, right? The fluid, the extracellular matrix. And this relies on a transport protein known as ABCC3. This is an efflux transporter protein. And then you need another protein, an active transporter protein called SLC22A9, to grab onto the minoxidil sulfate that's now in the extracellular space. Thanks to ABCC putting it there, you need SLC22A9 to grab onto that and import it into the dermal papilla cells. Now, if ABCC3 is underexpressed, the active drug being minoxidil sulfate never leaves the keratinocytes efficiently. And if that's happening, it's just going to sit there and waste away and degrade. And eventually, again, your body's going to break it down, and you're not going to get any sort of hair growth benefits. But if it does, then that's good. That's the first sort of bottleneck that you've gotten past. However, if SLC22A9 is weak, the dermal papilla doesn't take it up, and then you're not going to get that much effective growth benefits out of the minoxidil use. And again, I'll leave my post in the description below. So it's not just sulforotransferase enzymatic expression, although it does help to have a high expression of that in your hair follicles. So what's my takeaway point here? High-dose oral minoxidil does have a higher risk, of course, compared to low-dose oral minoxidil, but it could potentially give a even greater hair growth benefit, especially if you're someone that seems to have a sort of bottleneck or a poor response to lower forms of minoxidil, whether that's topical minoxidil or really just low-dose minoxidil between 0.25 up to 5 milligram. But again, you have to monitor your sort of physiological responses to minoxidil, especially at higher doses, carefully. And you have to titrate up to a higher dose slowly, not over the course of weeks, but rather the course of months. If you notice you're having persistent tachycardia, or you're having very, very low blood pressure that doesn't seem to adapt properly over time, then you probably aren't a candidate for oral minoxidil, especially at higher doses. And if you're not getting hair growth benefit even out of a higher dose, then it could be the case that you're just not a good responder in general to minoxidil. If you're a woman dealing with hair loss issues and you want to use high-dose oral minoxidil, you have to be very careful because you may start to develop unwanted body hair. Unless you're into that, then, all the power to you. I guess at that point it would be wanted body hair, so wanted body hair growth. I know there's some dudes that are into that. I don't know. It's certainly not my thing. I guess we can kind of, skip. I'm done. I think I'm incriminating myself the more I talk here. Well, anyway, going back to the study on a more relevant point, I do want to point out that obviously these people in this study were on anti-androgens, particularly 5-alpha reductase inhibitors, right? So you have to take that into account that could have had an impact on the efficacy, but overall, I think this study does a good job capturing the efficacy of a higher dose oral minoxidil. But yeah, that's pretty much it for this study. And really, this video. So thanks for watching this video. But if you got to the end of this video, here's the cool part. I started a company called Folligens, and you can check that in the description below. The website is folligenz.com, and there we're running a cosmetic. It includes minoxidil sulfate and other sort of botanicals in it, and it is a liposomal encapsulation of minoxidil sulfate. So I'll put that in the description there. You can, try it for yourself and see how it works for you. Anyway, thanks for watching this video, and I hope to see you on the next one. Peace out.